Now, this is where the magic happens. Once I've captured all of that, I can then go, and there's two things. One, you can see my notes, and the other part is a patient letter. I can click on that, put the patient details in that you can see come up here. So I'll enter a set of patient details. Sorry, you can't see that. It's just slightly off screen. That will come up. And you can see on the right-hand side of the screen there, that letter that's generated is off a template that I've given Kiroku that is the letter that I would normally spend hours writing. And that letter and that template, you'll just gets populated and prepared. And it suddenly enters this. And you can see here, suddenly, it was a pleasure to speak to you on the date. You've decided you'd like to look at having an implant to replace whatever tooth. You can see that actually all of the things that are relevant to this case, for instance, because it's an upper tooth, I'm not going to mention nerve damage to the ID nerve. It would automatically detect that. It will look at what I've decided to do, an implant-supported crown. It will look at the process. And this is the treatment letter that I would normally output. And this now is automatically on there. And it's used the logic of what I've put in before to actually inform the letter that's sent to the patient. And even better, I can now click on here, download that as a PDF, or download it as a Word document. And even better, or something that's coming, which I'm very excited about, is maybe even email this to the patient so that they can sign it automatically. So this can happen at the speed of light. And this is the letter that's been generated that you can see here that I've downloaded. You can see that actually within all of this, the process of collating the information, making it easier for us to diagnose better and quicker, making sure we've got all the information. And then with one click, with literally one click, we then output a patient letter. And this patient letter is now ready to go. And the patient can look at this and from there, start the process of signing it. That allows this to work so much more smoothly in practice for me. I've also got a set of notes you can see there with the report from the CBCT, and it also talks about the teeth which I've advised them to deal with, advised to treat carier's teeth, advised to treat defective restored teeth, and I've got really some very thorough notes from that session. Now, that's Kiroku Docs, the ability to take your notes and to turn your notes into a Word document or PDF document that is personalized for that patient and follows logic. When I say logic, I've explained one. If I'm replacing an upper tooth, it's not going to talk about the ID nerve. If I'm replacing a lower tooth, it's not going to talk about the maxillary sinus. If I'm doing an overdenture, it's going to give me the information that's key for that particular treatment that I'm offered. This is based on a series of templates that I've got that I've used for a long time. And these have been given to the people at Kiroku, and they've worked out how to turn that into, with logic and artificial intelligence, a document that is downloadable, emailable for signing, printable as well. So really, that's a huge change. Now, I mentioned one of the other things I spend a lot of time doing. I spend a lot of time writing letters to referring dentists. Now, with the same workflow, you can see here, I can click on GDP letter, and in 2 seconds again, GDP name, the patient first name, patient last name, and within that, the same information that I've added to the first set of notes that I've done with my nurse is now a letter to the referring dentist. It's there, it's ready, it's usable in that amount of time. And if we talk about efficiency, the amount of time that's going to be saved with a workflow like this, I'm lucky enough to have had a trial of this. This really is going to be a game changer, because the ability now to download or email that to the referring dentist at the beginning, middle, or end of treatment really is going to be such a huge time saver for us at the practice. So that's the magic. That's Kiroku Docs. That's what it does. It's going to buy you and me time.